So it's my absolute pleasure to chair this session. I'm not Katie. Unfortunately, Katie's not very well today. So my name's Donna. I'll be chairing this session. What we're going to do is I'm going to ask colleagues to introduce themselves as they start to speak. And we've got a series of pre-prepared presentations and then some time for a discussion at the end, if that's okay with everyone. And really what we're here to think about is how do you create the health creating communities leading change. And we've got some brilliant examples that colleagues will share with you. And then we'd also open it up. There are some tools on the table which we will get to. So the idea is that you'll also be able to take some things away and using those in your organisation. So without further ado, I shall pass to Adrian. Thank you. That's on.
Morning, everybody. We're still morning, aren't we, I think? Yes. Yeah. So my name's Adrian Ball. I'm the Chief Executive of a charity in Manchester called Manchester Settlement. We're a place-based multi-service community charity. You'll probably be aware of similar organisations where you're from. We're kind of a community centre but deliver lots of services attached to that as well. We were part of the settlement movement established in 1895. So we celebrate our 130th anniversary this year. I'll pause for any kind of congratulations there. We were a very proud organisation in terms of our ways of working and our impact upon health and poverty in East Manchester. But do you know, we've not achieved everything that we wanted to achieve. There's clearly lots to do around health, community health and poverty in East Manchester. So we press on. We deliver a range of things from childcare to supported housing for asylum seekers to kind of community centre, adult education type stuff. So our set of services, other organisations like ours will have similar or a little bit different services. But what really combines everything that we do is a real centering around our values. And I know it's easy to say that, but I really feel proud about the way that we do centre around our behaviours and our values, which speak to lots of the information, lots of the messages that we heard this morning about power sharing, power shifting, community empowerment, but crucially we have a value about pushing boundaries and challenging boundaries, and that's both internally and externally. So we're always trying to think quite deeply about our practice, whether we're delivering our housing support programme, whether we're delivering our nurseries, our community engagement programmes. We're always trying to give ourselves some space to think deeply about how we do that. When something has worked, what made it work? How can we reflect on that? What are the ingredients that make success with our work in communities? Always trying to think about that. In my thinking, in my leadership, I came across a book by Professor Nigel Crisp. Health is made at home, hospitals are for repairs. If you've not come across that book, I really do encourage you to read that book. And that took me to the work of the Health Creation Alliance. And between those resources, I really felt as though we'd found a home for our values and the kind of work that we were doing with communities. What did that Health Creation Alliance work give me? That home, it gave me a sense of a place and a movement that we could connect to, a movement for change. It gave me the hope of us having an evidence base that we could connect to for the type of work that we were doing. And it gave me a framework for improvement in the organisation. So, taking that, we began to shape that into how can we use this? How can we use this internally? But how can we use this to get people to buy into the approach that we can develop using health creation methodologies? And we managed to shape a proposal to Manchester Local Care Organisation, who you're going to hear from a little bit later this morning, which was essentially about how to invest in communities and community organisations rather than commission community organisations. So it was about creating a trusting relationship with us and Manchester Local Care Organisation, which would give the space for organisational and development and learning, not just about buying widgets, buying services from community organisations. So that started off quite small with projects out of COVID, where we got some money and we began to work alongside smaller partner organisations, and that's built up such that we now have delivered quite a few projects with Manchester Local Care Organisation that combine this delivery of traditional interventions in community organisations, but with a lot of space around organisational development and reflection as well. Investing, not commissioning. So that's where we are. I'm going to head back to some of my colleagues and then I'll come back in at the end. Thank you.
So thank you, Adrian. Just flick the sides. There we are.
Point to me at the back.
Great stuff. Lovely. So my name's Angela Beacon. I'm one of the neighbourhood leads at a local care organisation. And firstly, we're really thrilled to be able to be hosting Health Creation Alliance's Summit here in Manchester as well, and hope that if you're new to Manchester, to our wonderful, vibrant, diverse city, you've got a bit of an opportunity to explore whilst you're here with us as well. Hopefully not so much in the rain as well. Let's hope that ceases by the end of the day. So we know we've got people from all across the country here with us today. So before we throw a bit of a spotlight on some of the transformational work that we've been doing here, we just wanted to set out a little bit of the context around health and wellbeing in Manchester, which is the foundation for our health creation journey that Adrian's just mentioned. So both myself and Lizzie, who's here on the panel with us today, are both neighbourhood leads at the Manchester Local Care Organisation. And this is a pioneering public sector organisation that provides NHS community health services and adult social care services. We're part NHS and part local authority. We work as one team across traditional barriers to be able to achieve this. There are around 4,000 staff that make up the city's adult and children's NHS community teams and adult social care teams who are deployed into the local care organisation. Oh, reaching at the back. There we go. So they include district and community nurses, social workers, healthcare staff, therapists, and many other health and care professionals. So our teams work together as one single organisation so that care is better coordinated around the needs of our communities, which includes the development of a range of new integrated ways of working. So what we're doing, in simple terms, there are two main things that the MLCO has been set up to do: to make a positive contribution to help people in Manchester live longer and enjoy better health than many of them do now, and to improve community and neighbourhood care for people in the city. So whilst we manage community health and care services, we're here to do much more than that by ensuring that we work together in new ways to do things differently. It's a place-based approach to enable people to live well. So we know that living well, having good health, is key to the long-term future of our city and its people. And in taking a place-based approach to health and well-being, we're seeking to tackle health inequalities in our neighbourhoods using a population health-based approach. which is one of the strategic priorities for us at the local care organisation, and something that everyone can play a role in. At its core, this approach is about improving health through prevention and early identification of the things that impact on a lot of people's health. Obviously, there are multiple factors, risk factors, conditions that will impact on people in our communities, and it's impossible to tackle everything at once. So that's why we're using data to inform us. So we take data from the neighbourhoods that we work in, at a city level and wider, and we use it to help us to identify health inequalities. So who's experiencing these and where they're most prevalent? We can then identify where we can make the biggest difference working in partnership with our communities. In particular, it helps us to work with underserved communities to reduce health inequalities in a more proactive way. In having this focus, we know that we can not only reduce the health risks for individuals, but also reduce future pressure on hospitals, communities and social services so that they're better able to respond when they're needed. So better health is a shared priority across our city and across our neighbourhoods. And together we've built and we continue to build partnerships with our communities, which together recognises this. And it's this that's given us the foundations to consider how we can really do things differently, which has brought us to health creation. So the move to develop our local health creation programmes emerged over time, starting with some initial conversations with ourselves and Manchester Settlement about aspirations to test out and develop on the Alliance methodology, giving it our own local context. Listening to ideas about how this could be approached, we together explored how we could enable the early seeds of ideas to grow. But this couldn't have happened without the relationship and the trust that has developed across our partnership model. But it's not been easy to make this shift, even with the context that we shared about ways of working in Manchester, and it's required bravery. There have been a number of strategic and planning challenges that we've needed to consider. So how can approaches respond to the evolving and complex needs of people in our communities? Health and wellbeing is much more than access to direct healthcare provision, and determinants such as work and skills, income and housing are critical to developing better health outcomes, as we've been learning about this morning. So working together in participatory decision-making with local assets at the centre is enabling us to have broader conversations about what really matters to people in terms of their health and wellbeing, so that we can strengthen our impacts and our range of influence. Another challenge has been how to balance short-term and long-term goals. So while immediate needs are critical, and often the areas which grab the biggest headlines in terms of NHS waiting list or delayed hospital discharges, we must also align with broader health improvement, which needs time to develop and long-term investment. We know that this work isn't a quick fix solution. How to commission services based on solid evidence of their effectiveness, when this is new territory that we're moving into, where we're continually learning, the need for reflection, review, and honest and measured risk-taking is essential. So the challenge remains, and it'll be shared by us all on this health creation journey in many different ways, but the work that we want to present to you today shows that there are ways through this which can enable community-powered approaches to health creation to grow. So I'd now like to introduce Maqbul Rose from Manchester Settlement, who's going to tell you some of the detail about one of our programmes in Manchester. Thanks, Maqbul.
Right, get the glasses on. Okay. Okay, lovely. So I've been invited today to talk about the Vaccination Winter Health Creation Project. That's because at Manchester Settlement, I am the PM, not the Prime Minister, the project manager. I know you were thinking, you were confused. So, well, firstly, I want to say thanks to Adrian today, because without him reading that book and finding about health creation, I wouldn't have been funded for my project. But also thank you to MLCO for believing in Manchester Settlement and really taking a punt in understanding what health creation is, not looking just at health outcomes, but how we meet those health outcomes. That is so important, so thank you, everybody. Okay. So the Vaccination Health Creation Project ran from October 2023 to 2024. We were so excited at Manchester Settlements to receive funding that allowed us to provide financial gain to the voluntary sector with a project that focused on VCSE capacity building, time to implement interventions with thought and quality and make practice sustainable. You know, I nearly fell off my chair. A year project to properly work with the voluntary sector. The programme was delivered in collaboration with leaders from 8 BAME communities in 3 North Manchester neighbourhoods to help drive a reduction in health inequalities and enhance communities' winter health and well-being. The project from the outset was designed to embrace and enhance the power and potential of the voluntary organisations and to take the opportunity to use the concepts of health creation to support a significant shift in community power, enabling local people to be more in control of their own health and well-being. And we had 4 objectives. So these objectives were to co-design and deliver winter health projects with BAME group leaders, to educate BAME community group leaders in health creation practice, to establish a sustainable learning relationship network across health creating organisations for all partners in terms of learning, and to recruit and train, I love this word, an army of community health creators to continue health creation good practice. I think we've got a small army, but we are trying to get a bigger army. So, moving on. So I don't want to talk about the framework for health creation because we actually provide a 2-hour training session on this, and we have 10 minutes today. Well, I have 10 minutes today. But I wanted to explain that to achieve our health creation learning objective, we ensured that learning about the framework was implemented right from the start on this project. The framework was invaluable as it gave all project partners the same language to use, and us as well, and supported to identify strengths and weaknesses to enhance not only overall project systems, but also voluntary organisation delivery and our delivery at Manchester Settlement. And it would be fair to say that all of us were on this journey to becoming health creating, as we all started at different points with regards to the 6 features and 3 Cs that you can see on the slide behind me. So I'm not going to go through the whole framework, but the point I want to make here is that when you see the framework, you may think that you're doing all of this already. But when you actually look through the community lens and then truly reflect on your own practice, as we did, you recognise how you can do things better, as we did. By taking the time to reflect, being brave, changing your practice, and challenging yourself, and especially challenging those around you to adapt and change to be more health creating. And that is exactly what we did with our vaccination project. So here's our programme. So we actually grasped the framework with both hands and embedded it in all the project systems from planning to the final celebration event, which is what this slide is showing. We started by developing my understanding of health creation via mentoring sessions with the Alliance, and this enabled me to identify my strengths, for me to take control and lead on implementing health creation with the voluntary organisations. We engaged and upskilled our VCSE organisations via project launch, where information was provided not only about project logistics, but also about the framework. This launch ensured that we listened and responded to people's concerns. Therefore, our overarching Manchester Settlement project was adapted from what we heard. In my role as PM, Prime Minister, I provided ongoing support, which included advice and delivery, allowing individuals to develop their practice and confidence, we further developed those trusted and valued relationships, which I might add resulted in some gaining paid roles after the project. We disseminated our learning through various forms, firstly via volunteer training, where volunteers were supported to become health creators, sharing their practice and the health creation principles within not only their organisations, but within their communities, and also via our health creation platform, which was the main space for recruited organisations to connect and share information. Evaluation was implemented from the start of the project launch and continued throughout the project, obtaining quantitative and qualitative data and using various tools. And throughout the whole project, it was very important to take the time to reflect and learn, and this was represented at our celebration event planned with the organisations for the organisations, sharing their good practice and embedding the element of reciprocity, the give-get relationship, giving back to our voluntary organisations for all their commitment and their hard work. So in terms of outcomes, as you may imagine, in a project where you've got Manchester Settlement leading and then you've got 8 voluntary organisations supporting, I could have spent 10 minutes here today talking about our outcomes. So I'm just going to present to you the overall outcomes from the participant community level, and they found that they had increased confidence and developed greater control to positively impact upon the determinants of health, improved understanding and trust in vaccination programmes, increased feelings of connections, confidence and control when confronted by complex health systems. At the systems level, we contributed to reduced health inequalities, enhanced health and well-being, and improved contact between people in communities. And what do we learn? So what we learned is that our evaluation needed to be simpler and less onerous, to have an appropriate budget allocation for the voluntary organisations to secure buy-in, to have a project manager as a key person for support was invaluable, to identify organisation capacity so they could deliver the projects to mitigate dropout, and that the health creation platform was useful to share and connect, and that the benefits of the framework was acknowledged by all. And finally, the importance of valued relationships between all partners. So the project was deemed to be successful and lessons were learned. But what did we do with this learning? Well, MLCO stepped in and said, here you are, Manchester Settlement, we'd like you to work on a long-term conditions project, but we actually want to make sure that you still maintain your health creation principles with it. So here we are. This is a new project that we're working on at the moment. So it's to tackle long-term health condition projects. But I really want to talk about the methodology that we're using for this particular project because it covers the whole of North Manchester. So we're working in 4 neighbourhoods, and we're working in 4 neighbourhoods for 2 years, from April the 1st this year to March 31st, 2027. We have recruited 4 voluntary partners, 1 in each neighbourhood, who is a lead partner. And this is about embedding a neighbourhood strengthening model. And we have our lead partners in the room today. I would ask you to put your hands up if you're not too shy. Speak to them at any time during the day. We have Jay, we have Vicky, and we have Stacey. And each partner was given monies to recruit 4 micro-organisations to work with them so they could work with their communities and cross boundaries across the 4 neighbourhoods in North Manchester to learn from each other and share good practice. We are now in quarter 3 of our project and have already recruited and provided capacity building training, and we are now moving on to the project planning phase, working with the 16 small organisations. We have actually co-produced our own logo for Health Creation, which you can see there at the top. Health Creation Manchester, produced in collaboration with our partners. So again, this is a very exciting opportunity, and all I can say is watch this space. Thank you.
Next slide. So, hello everybody. My name's Shamine Jan. I'm the founder director of Bollyfit Active CIC. If you've never heard of it, just have a quick Google. And what a morning though. I've really enjoyed this morning. I've learned so many things that I'm thinking, we're already on top of that. And that's why I love coming to events like this, because it validates what we're doing in the community already. So my background is I've been a businesswoman for over 30 years and working with South Asian women really in Manchester a lot. And but 10 years ago, I needed a safe space to go and do exercise and get fit for my mental health condition. And I couldn't find it, so I created it, Bollyfit happened. Then when the pandemic came, it really helped me to understand that the problem that I had with my mental health and not finding a safe space for exercise, a lot of Asian women were actually in the same situation. And when I read the BB syndrome or the Begum syndrome, again, Google it to understand, I set up a CIC, Bollyfit Active CIC. So we've not looked back, but again, I've limited time, so I'm not going to spend too much time talking about my organization. But what I want to say really is that what I've heard this morning about agency is exactly what I took hold of. I didn't wait for anybody to give me that agency. I took control myself. So if we can, so our project, the one that we worked with, Health Creation and Manchester Settlement, it was an amazing opportunity. Again, it was a winter health project for South Asian women during winter time, which is the most difficult time for a lot of isolated women, which is who we're working with. Thank you. And the theme was keeping warm, safe indoors, talking about nutrition, hydration, vaccines, which is a big issue in the community. There's so much misinformation. So it gave us an opportunity to sit them down. I look like them, I talk like them, so they have that trust there. So all of a sudden they're learning things in a nice environment that's culturally competent for them as well. So slips and trips and falls, we've had all sorts of discussions in there, because again, when you have spaces where they trust you and they feel as though they can speak without being judged, they will talk about everything. So next slide, please. Do you want to? Yeah, thank you. So these, again, health creation, you've heard about it this morning. You've heard Maqbul talk about it. So truth-telling, listening to real lives, which you've heard about this morning as well. And that was the challenge, really. We had to, and I always find that it's not just listening, it's attentive listening and understanding people, yeah? So that was the challenge, and it was, like I've just mentioned, vaccine anxiety, they're worried about that. And again, the amount of WhatsApp messages that come through in our South Asian community, people tend to just believe that. So it was great to have information for them that we can share in a safe space for them. And isolation, again, like I mentioned, wintertime even worse. And due to isolation, their confidence is not there and their engagement with the services is not there. These are the challenges of working with South Asian women, because they're not heard, because some of them have a language barrier, confidence, and all kinds of complex issues, I think. So, and again, we talked about rising fuel poverty and home safety risks, which was all new for them, really. They hadn't heard about these things that we were talking about. So, yeah, and the strengths and the power shifting. Again, we co-designed it. I love co-designing. Let's say co-design. Go home with that, because you need to listen to the people who you're working with, which is what we did. Blend in their culture and then give them what they need, yeah, in an appropriate way. And it was all women-led, and again, we had women with lived experience leading it, so they understood the women that were working with. And again, local familiar spaces, it's so important where they meet. Those spaces have to be culturally competent as well. Those workers in those spaces have to be as well. And to tell you the truth, the best place we like to work is where we've got the key for that venue, because we are surrounding them with our love and our attentiveness and our trust that they've built with us. And Impact and outcomes, there were great, increased vaccination. We had people going for their flu jabs and stuff, and confidence was built with what vaccinations are for. Safer, warmer homes, stronger self-care habits were created, better nutrition, Asian women talking their own language about protein, carbohydrates, fiber was amazing to see, and hydration, the importance, especially in winter months. And again, confidence came out, built trust between us, and then us building their trust with their local health services, and peer learning, leadership, sustainability, because those women who were teaching them, they ended up being more confident in their leadership skills as well. So next slide. And again, just a quick case study. One of the ladies had already had a fall, but she came to learn about falls. And in our community, you don't say, oh, there's a session that we're going to do on falls. Come and learn about it. There's not very often this happens. So we gave them the opportunity to learn about sensor lights and how to prevent falls, footwear as well. And these women were then saying to us that they've now learned what they've learned, but they're passing it on to their relatives. This is the ripple effect of supporting communities in the right manner, that they will go and tell others, yeah? And this lady was saying she's telling her relatives in abroad as well, and she felt empowered, confident, and her family was surprised by what she learned. So, you know, a lot of the older women especially, you know, younger kids, because they've got the phones and the technology to learn so much, so they always think they know better. But when mummy's coming home and teaching them, great. So next. And again, Asma, our wonderful participant from Bollyfit, she was a nurse who'd gone out of work due to real bad health, and her mum passed away, her father passed away, so she was a really, really ill person. She joined Bollyfit, got great results. Then we actually said, why don't you project manage this program? Oh my God, the confidence it gave her. And being a nurse, can you imagine how any nurses here, or you know a nurse, they're strong women, you know, and males, yeah, go out and work, but she'd lost all her confidence. But coming and doing this, it empowered her, gave her purpose, again, mastery and control over her own health as well as the people she was guiding. And she became a leader, mentor, she's our coach, she's a facilitator for fencing now as well, so she's gone from strength to strength. And her journey embodies power shifting and system learning, creating the conditions for their health. What we learned is relationships are your infrastructure, yeah? We must build opportunities for building trust. Cultural identity is essential, that we need to understand these people who we're working with, and we don't create barriers. Empowerment creates sustainability, and people keep acting when they own the change. If they've developed the change, own it, then they will become it, and then they will teach it. And peer diffusion spreads messages faster than, cheaper than all the campaigns we have out there as well. And embedding it, yeah, the ask is to our NHS and council partners, embed health creation into your work that you do on a daily basis. Invest in trusted community connectors like Bollyfit, Active, and others out there, wonderful organizations, and value relational and confidence outcomes alongside clinical data. It's not all about the numbers, it's more about how people feel. And I love Ben for saying, you know, happiness, let's create happiness in the world, and that creates good health as well. And thank you very much for listening.
Thank you very much to our amazing speakers. So the disadvantage of it being in this room, we have more space, but it does mean that people will start coming in. So I'm just hopefully going to have time for a few questions. But the advantage of being in the morning session is you've met all these lovely people. So if we don't get round to your questions, please do reach out over lunch and continue the conversations. So has anyone got any questions for the panel? Or comments, anything that anyone wants to build from?
I just wanted to celebrate that. That was fantastic, and that's what I've been waiting to hear all morning, about how you built the capability of people in the community. So I just wanted to say, well done.
It's all right. We'll do a relay. It's all right.
Just a really practical question. Investment. What kind of quantum of investment are we looking at for something like this that is sustainable?
is it on? Can you hear me? Ah, great. Finally, I get the microphone. So, the investment in terms of money, I guess, if that's what... Who asked the question, actually? Are you thinking finance or all investment? So I think that Manchester Settlement, they were the people that sparked off, I guess, our kind of excitement about this model. And really, I'd say that was down to Adrian coming and talking to us and sharing some of the knowledge of the work that they're already doing. So, and Manchester Settlement had already invested, I guess, as an organisation in developing health creation through lots of the work that they were already doing. And we kind of wanted to build on some of that from the LCO. So we invested initially short-term funding to do the Winter Wellbeing Project, which is what Shamine was part of initially. And then we've now got future investment for 2 years, which for us has been, it's a challenge to get any financial funding for longer than a year in our world. So 2 years feels like a lot of time, although it's not really. We're already thinking about how do we build on that moving forward, because you're just starting, aren't you? Kind of with 2 years. So there's investment in terms of finances. There's investment in terms of knowledge and resource from the settlement already. There's also, we talked this morning, or we heard this morning about holding the space. We're also kind of, as in the LCO, holding the space. So I think Angela mentioned bravery. And sometimes it feels like we're holding that space between the people that give us the money and say, actually, we just want you to talk about vaccinations. We want more vaccinations, if I think about the project this morning. But Shamine gave a really brilliant example. Actually, it was about vaccinations in terms of truth-telling back to us about some of the concerns and the worries and the views of the community. But also it was about falls prevention. Also it was about cost of living. And it's a bit about holding the space with our funders to say, yes, you're funding us around COVID and flu vaccines, but actually we're going to tell you about some of the wider issues within our community. So we, as commissioners, are we're kind of pushing back on some of the requests from funders. So in terms of resources, it takes capacity and time and kind of courage, all of us collectively, to kind of push back on some of the traditional ways of resourcing and funding and traditional expectations around projects.
Thanks, Lizzie. Does anyone else want to add anything? How much? I was going to push that. Does anyone feel comfortable talking about pounds, shillings and pence, or would you like to defer that to over lunch?
I'll tell you how much we got if you like. So the shorter term projects, I can't quite remember, but the project that we've started now, the long term conditions project, we're getting 200k a year for this year and next, which is essentially that distributed model in terms of our coordination, thought leadership, training, etc., and then distributing that in terms of monies to our 4 community partners in their community leadership role, and then distributing that to their 4 micro-organisations for a balance of activity, and their payments are payments for activity and payments in lieu of them engaging in the learning framework that we've got. That 200, when that flows down, each micro-organisation, however, is only getting around 4k for their project. So that's the 200 is great. This is North Manchester. I don't know how many people live in North Manchester, but it's perhaps I should do. We're modelling, even at that scale, we are still very much modelling how this dissemination, how this model of distributed power can work. But clearly we were delighted to secure that level of investment.
If I just add on to that as well, so it might be worth saying part of the reason why I've had the opportunity around this bigger pot of funding for this programme, like I say, it builds on the momentum and what we've started to have and started to prove from these smaller projects that have been delivered so successfully. I think there's a really strong narrative and story happening now around those. And in North Manchester, if you don't know the area, we've got North Manchester General Hospital, Crumpsall Hospital of Old, which is one of the redevelopment hospital sites which are being prioritised. And as a part of that, there was some money set aside for community health and wellbeing and what that could mean. And it seemed as though there was starting to be some ideas around potentially a building, a community health building where there might be kind of community services potentially delivered from that space. But I think from our point of view, we could see the opportunity maybe for sort of switching that thinking around creating another building, new building. We've got some amazing assets already here. Manchester Settlement being one of those, which has an amazing resource. Bollyfit Active, you have your own spaces that you work from, so many other of our community assets. So why can't we kind of partner with organisations in a different way? And like I say, being able to take a programme over 2 years to, again, help to build the story, build the evidence of sustainability, that this is the right thing to do. And we hope that over the next 2 years we've got more of the foundations to be able to do that, because this is only the next stage and what we want this story to be as well. We're always looking out for what the next opportunity is going to be to sustain it further, I think.
Thank you. I think what's really good about these events is get to know people, and it's a really good way of nicking other people's business cases, because it is about how then that we create that movement is we learn from each other. So there's quite a few hands up, so I'm going to see if we can do there.
Here, and this gentleman indicated he'd like to
Okay,
speak as
should we?
well, and then here and here. So we'll
Can we hear from everybody, and then we'll ask the panel to sum up, if that's okay. Thank you.
Hi, I'm Juliet Grace from Derbyshire Voluntary Action, so VCSE. I think this is really helpful conversation, and certainly the health creation approach and model is something that I want to take back to Derbyshire. And part of that is because of the conversations that we're having at a local level there. We currently are working on 6-month funding streams. We are losing staff. We're losing skills and real, opportunities every single day. We're working with our reserves. We're losing VCSE organisations every day. And yet when I am in conversations, I'm still hearing, well, yeah, but you still hold the real power because you can talk to people and you are closer to communities. But there's still a huge way to go to trusting the VCSE to know and to release those resources. So I just wanted to raise that please, I'd like to know how you get 200k in one fell swoop, because that would release so much power and opportunity. So yeah, another conversation to be had.
Can we just quickly whiz around the room, and then I'll ask panel members just for their final 30
It's just
second
a
thoughts.
quick clarifying conversation, really interested about what you said around potential of redeveloping a major hospital site, and then the possibility of redistributing that cash to existing buildings used by the local community. Is that, did I hear you right, that was an active?
Yes.
Ooh,
yeah.
that's really nice.
I feel that'd
So
be a
this
really
is,
good
I
coffee
suppose, yeah, it's
conversation.
part of that bigger shift that we want. This was a very specific opportunity in North Manchester, but exactly the kind of space that we want to move into, isn't it? Yeah.
So I'm just going to clarify that, because the funding did not come from the hospital rebuilding part. Just to be really clear, the funding came from the local care organisation, who had put some funding aside to develop health and wellbeing. So just to be really clear, not from the National Hospital Building Programme.
So I guess I was just interested in how that money could actually support local community assets and buildings, like actually for their own sustainability, rather than a big infrastructure that covers the whole region.
Thank you. Just final.
Hi, yeah. David Stone from Driftwood Studio. I just wanted, Shamine mentioned Ben's comment about habit. Now, Ben brought up the subject of kind of metrics and measurement. quite often there's a disconnect between, the higher level kind of, measurement of these things and what's going on the front line for people. We need both practice-based evidence and evidence-based practice, right? But to that end, I just wondered, are any of you working with universities? I mean, I train as an occupational therapist. I love what you're doing, by the way. That really sings to me.
You can join us.
Oh, well, I'd love to. Are any of you working with, say, Salford University's Allied Health Department or capitalising on that resource?
Just while we pass the microphone to the final question, I think it's from Debs, there is a session this afternoon on researching health creation, so I'll point you in that direction, because as an organisation we have a number of links to universities, so I'll just stay to that.
There was another question over here first, sorry.
Fine, thank you. So I'll take those last two questions and then I'll ask people to sum up, because we are heading towards time. Thank you.
Very brief. Hi, I'm Colin Bartels from University of Birmingham. Just building on the conversation so far this morning about money and power being kind of at the heart of the change that we want to achieve, and came up here as well, and then you see there's all kinds of sensitivities about that, and in my experience there's lots of politics around who gets the money and who has a seat at the table and who has influence between very small local organizations, kind of the bigger community anchor organizations, the Voluntary Sector Services Council. And I've experienced it in a number of different places, so I wonder how do you deal with that, keeping everyone on board and kind of promoting good relationships, working together towards shared purpose, shared learning.
Thank you. We'll take the last question and then you can choose, panel, which question you'd like to answer. And if you don't get your question answered, find the panel member over lunch.
Wow, powerful story of change. Fantastic to see all that work. My question was linking to the earlier conversation. So I know Cordell shared some of the work around making Manchester fairer. It's how we're amplifying the voices and the experience of the people being involved in this programme and feeding it into those policy shaping discussions around what we're doing as a region around poverty, creating better housing, employment, fair employment. It was just, that side of health creation and how it's linking into that policy agenda.
Thank you. So if I ask panel members, I'll start with you, Adrian, just to vaguely indicate the person to whom you're answering, and you've got 30 seconds.
Okay, really, I'm going to try and do a few. The measurement dilemma, I'd already written down the measurement dilemma before you spoke, and I think there's some guidance that comes out of the health creation around basically pointing towards commissioners, investors, as I would like to talk about them, in terms of just don't overmeasure, and that's generally been our drive throughout all these projects, is that I get what was said before, was it Ben, about data, but the voluntary sector, we just haven't got the infrastructure and the capacity to do that, and it's a fallacy to think that attempting to do that in any way without resourcing it properly and without the skills is the right use of the time for a voluntary sector organisation to do that. So we've just fought for a space where we can feed back in terms of case studies and impact stories, and that's what people have been happy with. The health creation framework enabled us to get, I think it was really useful, enabling us to latch on to a national body of evidence and almost say to commissioners, as perhaps they were them rather than investors, in doing this, you're not just buying a yoga session, you're buying something which is connected into a national evidence set. And I think that was part of creating the confidence to invest in us at this scale. In terms of politics and voluntary sector networks and all those kind of things, I guess I sit on lots of strategic bodies in Manchester, and I have to be trusted by voluntary sector colleagues to do that in an appropriate way. All I can say is that you just need people that are going to act in an appropriate way. There's no science behind that. I can't justify my position in being able to do that I just work with integrity and hope that, that our partners trust in that.
Literally 30 seconds each.
Right, very quickly. So a couple of points. I think kind of building on the point around evidence and research and knowing the story, that's been really difficult for us. We've had lots of conversations about how we measure, what we want to measure, making sure that that is within the capacity of the organisations that we've got. And one of the other conundrums that we've had is that we're working with 16 organisations, 16 micro-organisations within this current programme. So also how do we tell one single, clear, consistent story across lots of different priorities that those communities will be identifying with different activity running alongside them. So I think, you know, connections around that research space and opportunities there we'd be really interested to hear, I think, as a local system. And also the partnership working that we have across Manchester as well. We're developing this all the time, but I think this programme of work has only come from that trust and that relationship that we've had in our places. There's so much that's place-based. We've got a city of Manchester. Lots of this work has come from very kind of hyper-local conversations as well. And I think that's been the key to how we've got to the point that we're at, I'd say.
I just wanted to talk about the role of the project manager because as a project manager for these health creation projects, you have to be a different type of project manager. And luckily, the way I work is very natural to me. Got a background in public health, in education and in community engagement. And these are all the three factors that I bring into my relationships. So I really want to talk about the voluntary sector, how we raise the profile and give them a voice. But what is key to me is about relationships. So as a project manager at Manchester Settlement, I don't walk into a room and say, right, you've got this amount of money and I want you to do a project around diabetes. I walk into a room and I say, what is your concern? What do you need for your communities? How much money do you think you need? And also I say, what can I do to support you? And that is so important to me because when we talk about support from Manchester Settlement, we talk about training needs, we talk about how to become a facilitator. We really live and breathe the 6 features of health creation. I really try to ensure that people can self-organise, that we use their strengths so that they can get jobs and become facilitators after the project. But we also listen and respond, and we have so many difficult conversations in our groups because we base everything on trust and honesty and transparency. So I'm really proud to say that the project manager role is really keen in these health creation projects. It gives me the role to become a voice for the voluntary sector because we actually work with them and they take control to show how they are meeting health inequalities and tackling their issues. And then we can take that information back to the commissioners and the funders. Thank you.
Just very, very quickly, it'd be very amiss of me if I didn't thank Maqbul Rose for her work, which has been absolutely central to making all of this happen throughout all of the projects. Her personality, her care, her commitment to the project, none of it would have been possible without that. So it's very important that I acknowledge that. Thank you.
Thank you.